the 4 types of dysbiosis, not necessarily SIBO, but the 4
SIBO.
types of microbial overgrowth one could have. The first one is hydrogen SIBO. So there's an overproduction of hydrogen-producing bacteria that have made their way into the small intestine. Commonly, this is E. coli or Klebsiella, and they are producing large amounts of hydrogen gas. So that would be considered hydrogen SIBO that somebody could have. There also could be hydrogen sulfide SIBO. They sound similar, but very different. Hydrogen SIBO is commonly associated with diarrhea. Hydrogen sulfide is associated with urgent and painful stool, not necessarily always diarrhea, but that could include other gut bugs like F. barium, Desulvivrio. Klebsiella can be a sulfur producer as well. So there's a different variety of hydrogen sulfide producing bacteria. You have methane IMO, because it's not only in the small intestine, it could be an overproduction of methane gas from a type of gut bug called Archaea, either in the small intestine or in the large intestine. So those are 2 areas where you could have overproduction of this type of methane gas. Methane IMO is commonly associated with bloat and constipation. So if you're super bloated, super constipated, you've been diagnosed with IBS, you want to make sure they ruled out methane IMO for you. And the last type is SIFO, small intestinal fungal overgrowth, or it could be just fungal overgrowth in your small intestine or your large intestine. This one is not as commonly supported because we just don't have a lot of information about it. There are some really amazing gastroenterologists and researchers who are researching more on SIFO. Satish Rao is amazing in this aspect and in this field. He's a very highly respected gastroenterologist who speaks a lot about fungal overgrowth, but that absolutely can be another form of dysbiosis that one could have. And with that fungal overgrowth, symptoms could commonly be constipation, extreme bloat, and then just yeast symptoms. So white coating on the tongue like oral thrush, a lot of dryness and itchiness because yeast are very drying. So dandruff could be a symptom, dry flaky skin in the ears, dry flaky vaginal skin or vaginal itching, or itching in moist places like nasal itching, ear itching, itching on the scalp where it's oily as well. So you want to really make sure your care team is helping you assess, do you have any of those 4 types of dysbiosis?